America built its modern social contract on a simple idea. If people worked, paid payroll taxes, and trusted the system would deliver retirement income and health coverage later. That promise is now colliding with arithmetic. The Congressional Budget Office projects a federal deficit of $1.9 trillion in 2025, with total outlays of $7.0 trillion, against revenues of $5.2 trillion. In the same baseline, outlays equal 23.3% of GDP in 2025, and CBO says the main reasons spending rises over time are growth in Social Security, Medicare, and net interest costs. The debt side is where this stops being abstract. CBO says federal debt held by the public is already historically large and is projected to keep climbing, reaching 107% of GDP in 2029, above the prior record set after World War II, and then rising to 156% of GDP by 2055. CBO also projects total deficits averaging 6.3% of GDP over the next 30 years and reaching 7.3% of GDP in 2055. That matters because this is not a temporary wartime spike or a one-recession anomaly. It is a structural path in which the government keeps promising more while financing more of it with borrowing. The most dangerous part of that path is interest. Treasury's 25 financial report says net interest spending hit $970 billion in fiscal year 2025, more than budget outlays for national defense, and up 181% from $345 billion in fiscal year 2020. CBO's long-term outlook says net interest equals 3.2% of GDP in 2025, rises to 4.1% by 2035, and reaches 5.4% of GDP by 2055. In plain English, America is moving toward a future where an enormous and growing share of federal money is not buying new services at all. It is paying for old borrowing. That is what it means when the past starts consuming the future. This gets worse because the country that designed these promises is not the country that exists now. The U.S. Census Bureau reported that from 2023 to 2024, the population aged 65 and older rose 3.1% to 61.2 million, while the population under 18 fell 0.2% to 73.1 million. Census has also said that by 2030, all baby boomers will be at least 65 years old. Social Security's own data show the support ratio has deteriorated sharply. There were 5.1 covered workers per beneficiary in 1960, but the 2025 Trustees material says the ratio was only about 2.7 in 2024 and is projected to fall to 2.3 by 2040 and 2.1 by 2100. Under the intermediate assumptions, a system built for a broad worker base and a smaller retiree base becomes much harder to fund when that ratio gets cut nearly in half. That is why Social Security is the center of the problem. The 2025 Social Security trustees say combined OASI and DI reserves are projected to be depleted in 2034. They also say annual OASDI cost has exceeded non-interest income every year since 2010. Cost is projected to exceed total income in 2025, as it has since 2021, and after combined reserve depletion continuing, income would be enough to cover only 81% of program cost for the rest of 2034, falling to 72% by 2099. The same report says the OASI trust fund alone is projected to be depleted in 2033, and the combined system now has a 75-year actuarial deficit of 3.82% of taxable payroll plus a present value unfunded obligation of $25.1 trillion through 2099. That is not rhetoric. That is the trustees saying the scheduled promise and the dedicated financing stream no longer match. You can see the pressure building in the scale of the beneficiary population itself. CBO says the number of Social Security beneficiaries rises from 70 million in 2025 to 82 million in 2035, then to 97 million by 2055. It also says the share of total retest federal spending going to the major healthcare programs, and Social Security rises from a little more than 1/2 in 2025 to 2/3 in 2055. That means more and more federal money is effectively recommitted before Washington even begins arguing about defense, infrastructure, education, industrial policy, or anything else. Once a budget becomes locked by demographics and interest, politics starts feeling theatrical because the real flexibility is already gone. Medicare is even harder because health care inflation is less predictable than pension math. The 2025 Medicare Trustees report says the hospital insurance trust fund is projected to be depleted in 2033, which is 3 years earlier than projected in last year's report. The trustees attribute that change mainly to higher than anticipated 2024 expenditures and higher projected spending for inpatient, hospital, and hospice services. They also note that from 2025 to 2034, HI income is projected to be about $12 billion lower, and expenditures about $250 billion, higher than they projected a year earlier. And if the trust fund were depleted, Medicare could pay Part A, providers only to the extent permitted by ongoing tax revenues. That is a fancy way of saying that the program's financing cushion is thinner than the public is usually told. The broader federal budget makes clear that these are not isolated program problems. CBO says mandatory spending rises from 14.0% of GDP in 2025 to 16.1% in 2055, driven mostly by Medicare and, in the first decade, Social Security. It says major healthcare program spending rises from 5.8% of GDP in 2025 to 8.1% in 2055, while total outlays rise to 26.6% of GDP by 2055, a level exceeded only during World War II and the pandemic. Meanwhile, revenues rise too, reaching 19.3% of GDP by 2055, but they still do not catch up with spending. That means this is not just a tax problem or just a spending problem. Even with revenues rising, the spending side, especially aging-related spending plus interest, outruns the system. The usual political response is to pretend growth will save everything. But CBO's warning is blunt. Large and growing federal debt slows economic growth, drives up interest payments to foreign holders of U.S. debt, makes the fiscal position more vulnerable to higher interest rates, heightens the risk of a fiscal crisis, and increases the likelihood of other adverse outcomes. That is why America can't afford these promises anymore. Does not mean retirees will wake up tomorrow to nothing. It means the current structure is forcing the country into a narrower. The hardest truth is that these promises are popular because they are real and valuable. America did not just make generous promises. It made promises on assumptions about demography, growth, and financing that are no longer holding. So the real issue is not whether these programs should exist. The real issue is whether leaders are willing to tell the public that preserving them requires change. Every year of population aging means the worker-to-beneficiary math gets harder. America can still choose how to adapt these promises. That is the story beneath the politics. Not that the country suddenly became poor, but that the financing behind its biggest promises is deteriorating faster than its leaders are willing to admit.